Well, welcome to our ongoing conversations with communication exemplars. Today we have Dr. Peter Hull with us, and he'll give you a little bit of his background. But as we've talked about before, this is an opportunity for you to hear firsthand how communication works best in organizations and to try to bring what you're doing in your textbook exercises and from my rambling lectures into some actual application. So Peter, welcome. And
Thank you.
We'll have about 30 minutes here to get your wit and wisdom. We probably need a week, but 30 minutes is all we got.
Hope I can fill up the time.
First of all, we have a global population of students, and they may not know what Sutter is. So if you could give us a thumbnail of what Sutter Health is as an organization, who it serves.
Sutter Health is a community-based, Northern California-based healthcare organization. We started right here in the Sacramento area, but we've expanded as far south as the middle Central Valley and as far north as right near the border of California and Oregon. We have 20-something affiliates, I'll get the number wrong, and many of them are in large cities, and some of them are in suburbs, and some are in very small towns. So the purpose and the underlying theory of Sutter is that it is there to treat the community that they live in. So that's our philosophy.
And you operate in the not-for-profit environment?
Correct.
Excellent.
Correct. Yes, the facilities have all been established as not-for-profit, so that whatever excess money comes in is distributed to make certain that the healthcare in the community is not just at a basic level, but is the very best healthcare available anywhere.
Excellent. And now we can get into things that may not be quite as tricky. What got you into medicine?
You're hoping my amnesia is better, I guess, obviously.
Well, working on joint dements, we're going to the interview. We'll be all right.
Well, I'm the son of a veterinarian. I grew up working with my dad. He's a large and small animal veterinarian in Illinois, and I really liked medicine, but I really didn't appreciate a job that I would have to work outside, especially in the Midwest in an Illinois winter, or in the middle of the summer. I thought I'd really appreciate a job in which I could work inside. So I realized, all kidding aside, I realized that veterinarians are very special in they have a connection with the animal.
Right.
And some people have it. My brother had it. I didn't, and I realized it wasn't the right brand of medicine for me. But I always liked all the other aspects of it, and being able to take care of something or someone when they were sick is important to me, and that kind of is what drove me. And I guess I had some appreciation and some degree of ability to do science and to do the core studies without it being profoundly painful.
So organic chemistry didn't kill you off, right?
It came incredibly close, but didn't quite do it. We battled hard, and somehow I came out victorious. So.
Excellent. And what type of medicine do you practice?
I practice emergency medicine. I decided that when I was in medical school that I was going to be a trauma surgeon, and I went forward through medical school young and full of myself, and sure that that was the only field that I would ever go into. And I did an internship in surgery and realized I wasn't completely happy. In other words, the taking care of acutely ill people I enjoyed, but the taking care of, but the going to the operating room for hours on end I didn't appreciate and like that much. So I had to start searching for something else I would like, and it just so happened a month or two later I was doing a rotation in emergency medicine. I thought, oh, this is definitely it fits my personality, and it seems like I'm capable of doing it. So I really kind of fell in love with it and continue to kind of love it as a specialty.
Excellent. Well, just by way of background, we want to coach you on lifestyle choices because while this guy's a really good guy, you don't want to see him professionally.
Right, right. And we get to see all the poor choices people make,
Excellent.
but we don't judge, and we just do our best to take care of them and make certain that we're there when they need us. And that's part of what you end up loving about it is that, as I tell my patients, I said, we're always here. We never sleep. So we're there. And the people that come and see us, by and large, really appreciate the fact that they know this is a huge part of our social safety net, that's out there. And if somebody does make a mistake or does something in error or somebody gets really sick, we're there and have the expertise and really the desire and love of taking care of people that are sick. That's what we train to do.
Excellent. And I try to stay out of hospitals as much as I can. But I've noticed that there's different environments in different parts of the hospital. I notice emergency rooms seem to have a culture. The ambulatories seem to have a culture, and ED kind of has its own culture.
Yeah.
What's the difference between the various parts of a hospital operation?
I think that all medical specialties have their own archetype. They have their own special culture that is common to them. ER doctors get to know that because we talk to virtually every specialty, and we get to know what every other specialty is like. So surgeons have a very specific type, and they're very detail oriented, and they're to ER physicians seemingly sometimes a little more compulsive than we would be, but that's kind of what you want in a surgeon, and the different areas of the hospital sort of reflect the physicians that are serving in them.
Excellent. And just from an outsider looking in, it seems like the chaos factor in an ED is very different than other parts. Is that a fairly accurate perception?
Well, I always say that the ER is not. It's chaotic to the outside observer. It's not chaotic to most of us working there. As a matter of fact, unfortunately, I think that the ER is a little too normal for most of us that work there. In other words, I think we can lose sight of the fact that certain people may be there in a moment of extreme anxiety or extreme pain, and we always have to remember to be sensitive to that because it's not. This is our everyday workplace. These are all our friends we work with, and we are a very tight-knit community. But not everyone understands that we can eat, the snack food that's brought out 5 feet away from someone who's vomiting or something like that. That's definitely our personality, though. So.
Right. That's what makes you interesting. But it kind of brings us to the point of where we'd like to concentrate a fair amount of our time is in observing the ED departments. It seems like those are very finely tuned teams that are working in there. We'd really like you to walk through sort of the team building process, starting with how do you go about selecting members for the team?
Well, for the ER, a team really is made up of the physicians that are working, and they're sort of multi-dimensional teams that are occurring at any one point in time. I always like to think of the patient as being the center of the most important team, which is often the physician and the nurse, sometimes a technician, but there are also other teams that occur too. There are physicians working with other physicians, and there are physicians working with the structure of the ER to make sure the ER is functioning well. In other words, a charge nurse or someone like that. So we don't always get to completely select the team that occurs. We have to maximize the team that we have. Excellent. And so the team that you're often given on any given day will be very different from a team you might get on any other day. And our ability to all work together is dependent somewhat on the inherent personality of the physician, and the physician sets the tone of what will occur. But the nurses also assist with that. But the physicians have to be, they have to have the ability to communicate well, communicate openly with everyone else on their team and what they need. And some days we have days where it's a casual team. I'll talk to one nurse and say, we need this, and this is what I think should occur. And then at other times, the team becomes very acute and focused, in other words, on a critically ill patient, in which the things that we do in the next 3 minutes, in the next 6 minutes, in the next 10 minutes are going to determine whether or not this person survives, or whether or not how much they're damaged by what's happened as well. So at those moments, I say you sort of spend your capital that you hopefully have built up on those more casual patients. At those moments, you're in a time of crisis. You have to communicate with absolute, direct, and unequivocal orders that need to be carried out perfectly for things to occur well for the patient. We have people that sometimes think that every moment is a crisis, and they have trouble building the right teams because they don't. Everything is a crisis. So when they're communicating about something that isn't critical at that moment, it doesn't make as much sense to everyone in the team why they're being that acute at that moment.
Is there a certain personality type, both on the nursing side, the technical side, technician side, that are attracted to the ER type of work?
I think there is. Yeah. I think that our nurses, although we have a variety of ages, and I love the younger nurses we work with, the older nurses we work with. They're all very good. They tend to have the personality where they can manage a lot of variability that occurs. I don't call it chaos as much, but for us it's just more variability. Some days you'll have several sick patients. Some days you won't really take care of many sick people at all. I worked the other day and didn't take care of anybody that was profoundly ill, a few that were somewhat sick, but I got to do some things too that I don't always get to do, some procedures and things like that. So I think for the personality type, they like some excitement. They like things to change every day. They want it to be different every day. And the same is true for the physicians as well. Sure. We want it to be different from day to day, we want it to be something unusual or different. And quite honestly, I think every day I work, I think, I don't know that I've seen that before.
Excellent.
And that for some people would be, especially for many physicians, that'd be incredibly disconcerting. For ER doctors, it's like, oh, well, that's unique. I like that. That's interesting. So
it's a chance to learn.
It's a chance to learn, exactly.
Okay. Well, that I think is one of the key points in designing teams. It's first of all, you look at folks that are comfortable in the environment in which the team's going to work. And it sounds like if there isn't that personality type, probably physicians elect out of that kind of work.
Right, absolutely
and probably
they
the
do.
nursing staff and the others tend to do that too.
Exactly, they absolutely do. And it's interesting because younger nurses often are drawn to the ER, and many ERs don't hire first-year graduates. They tell them to go out and get experience somewhere else, and then they can come into the ER after that. But it's not always. It's that personality, but also being able to sort of maintain and have some buoyancy as well. I think the people that are able to do it long term are what I would think of as kind of being emotionally buoyant. They sort of, when they walk out the door at the end of a shift, they aren't necessarily carrying everything with them, because if you do, then it can become pretty overwhelming pretty fast.
Absolutely. Well, the other thing that I'm picking up out of the conversation is, as the leader of that team, there isn't a single communication style that works that
Yeah, not
there's
always.
times where you're casual, and then there's times where you have to be more directive.
Right. Yes, absolutely. I always take the moments when it's not critical to really make certain that everyone feels comfortable. And it comes as a surprise. I'm sometimes a little loud. In the ER, I'm probably as comfortable as I am in any social circumstance I'm ever in, just because I've lived in it for 20 plus years. And I have to realize that I can be loud at times, but I need at other times to be more calming, especially until staff gets to know me and realizes sort of my style. I have my moments of being a little sarcastic.
Right. Well,
And
we call it a unique sense of humor.
it is a unique sense of humor, yes.
Right.
And I think the nurses I enjoy working with the most sort of get that, and also know the moments when it's time to kind of switch gears, because that's kind of how I see it. Is we have a first and we have a second, we have a third and a fourth, and then we have an overdrive. And there are sometimes when we're going very fast that we need to make certain that everybody kind of has traction with that as well.
Well, one of the things that we do to help mold our students for the workplace is subject them to a lot of team activities. And in this class, part of the class can choose to have a number of practical activities that they engage in. And in order to do that, I put them in different teams. So through their 16 weeks with me, they may be in 5 different teams.
Yeah.
Can you give them some tips on how a team can come together faster? Because you don't have time to mess around. I mean, you have a new team at start a shift, and you got to get them gelled.
Right. Well, it'll change several times too. The nurses go on and off shift in times that are different. I think you really need to do everything you can in those circumstances to kind of up your own emotional intelligence. You really have to engage in what the key players in your team are about. And for me, I recognize my ability to be what I would sort of say is my native personality, a little more boisterous, a little more fun-loving, doesn't always work. And I have to recognize that, is that in certain teams, I need to be a little more subdued. I need to speak a little more directly and calmly. At other times, I get to be a little more fun-loving, I might say, even gregarious, even. But that doesn't always work, and so you have to recognize and be reactive and responsive to what that new team may be. Sometimes I realized in a recent class I took, I didn't always have to be the leader, and I could step back and let other people take that lead role. And at other times, it might be appropriate for me to step up and be the leader, but I didn't always need to do that. And if I sort of stepped back and just allowed everything to come together, I often found that my rightful place would be assumed. It wasn't a difficult or even often a volitional choice. It just came about.
Excellent. Well, your dynamic is also pretty unique in that you have the dynamics within your team, but then you have a patient that needs a certain communication style also. That's got to get really tricky.
Absolutely. I mean, certain times realize I deal with 0 to 100-year-old.
Correct.
So everybody requires something different. Sometimes I'm going to be speaking to an elderly spouse of a patient who might have dementia, and I can't communicate with my patient.
Sure.
Sometimes I'll be talking to a parent who I need to enlist in helping us calm the pediatric patient down. Sometimes I'll be dealing with people with mental health issues. So they all require challenges and knowledges about yourself to be able to manage those circumstances appropriately. You can't walk into the room the same way every time. It doesn't always work.
And even during the shift, it sounds like that things sort of change.
Yes.
The other piece that we try to emphasize with the students that we work with is when they go into organizations, teams, groups, organizations are going to set performance norms for them. How does that work in an ED department?
Well, our our norms are set around around patient experience typically, how long the patient spends in the department, and quality metrics around the what the patient may require getting in a timely fashion. And once again, your capability of being able to have your team work together and communicate effectively is critical. That's what's going to bring about the best care for the patient.
And is feedback provided to the team members fairly directly about their level of performance within the team?
It's provided, but usually the feedback is given in a more global fashion. Individual feedback in our circumstances within healthcare is necessary, but at times can feel overly judgmental, pejorative even,
Sure.
And you have to avoid that. So you try to make certain if people are clear outliers that you really communicate that what your expectations are and how you may assist them in getting them up to the par that they need to be. But by and large, we try to talk globally about what will bring about better care. And oftentimes, it's system issues and solutions that produce better care than it is individual outliers.
Yeah, what I've enjoyed in working with healthcare is the mentality where you're continually challenging the process, not the individual.
Correct. Yeah, and then we spend a lot of time. I've seen the progression in my time where feedback to physicians, peer review, went from being you did something wrong,
Pointing
and
fingers.
you did something wrong, and don't do it again, or there's going to be a consequence to what went wrong. How can we talk about this as an opportunity for us to give better care? How can we address that opportunity? And a lot of times, sometimes it may be individual, physician, nurse related. Sometimes it's system related. Sometimes it's some of our ancillary reliances that we have that are preventing us from sort of achieving perfect care.
I mean, if you think about it, that no one on that team just walked into an organization one day and got on that team. They spent years
Correct.
in professional training. They have a tremendous amount of experience, and they don't come to that team thinking, how can I mess up?
Right. That's never the perspective. And we talk et cetera about something called just culture, which is what is it people are doing? What is it we can do to support them? Right. How do we identify what is less than perfect care, and how do we communicate that appropriately to the individual, to the organization, and how can we all learn from that to make certain that whatever isn't perfect becomes, or works toward being perfect.
Excellent. Well, one of the joys of my job is I have the privilege of working with our really cool students that are just starting out in a career, and then I get to work with mid-career and then folks that are very, very experienced. But one of the common behaviors I see with the folks that are in university is that tendency to be very judgmental as part of a team. And I really appreciate your conversation to say, look, there's another way of doing this that's going to get a result that you're going to be happy with.
Yeah, for us, it's being able to really identify the issue that occurred and to correct it, and recognizing also that most people in healthcare really put their heart and soul into it. I mean, from the secretary that sits in my ER to CEOs of major healthcare organizations, I think they're all highly, highly dedicated and really sincere in their efforts about trying to make improvements and to give the best care to everyone they can, and recognizing that if you kind of take a moment when they've made a mistake to attack them and bring them down, it really doesn't help. If you take that moment and can build them up from that, you're going to produce somebody that's sustainable
Right.
in their career and is continually working toward improvements.
Excellent. And I think as the students are looking at career fields, we will have conversations through the whole semester on finding organizations that your values align with. And that's one of the things I found in spending time with your organization is from top to bottom. There's consistency of dedication towards a core set of values, which is very, very refreshing.
Very true. And I've seen senior administration people in circumstances where they feel like things haven't gone well, even if it wasn't their fault.
Right.
They take responsibility, and you can tell how much it bothers them that things didn't go well.
Exactly. On a more micro basis, do you have the opportunity at end of shift to do any debriefs of the cases that you've handled, or are things moving so fast that that's not realistic?
We often don't. One of the things I try to do, and I don't always succeed at it, is also, but take somebody, maybe it's somebody that I haven't always had the perfect interaction with, or
Sure.
we haven't kind of reached that sort of perfect state of I know what they're thinking and they know what I'm thinking, and just tell them, hey, you did a really good job. Thank you. I really appreciate your efforts. It's amazing what gratitude can do to
Yes.
make people feel that their job has great meaning and great purpose.
Excellent.
We do debrief sometimes on really difficult or unusual cases.
Complex cases.
Cases where there may have been a death. Just so that it's not an analytical debrief as much as it is probably a social debriefing and a chance to check in with everybody and make sure that people are doing okay. And you can learn a lot about
Sure.
people at that moment. Some people will have a tremendous emotional response
Yes.
to something they maybe weren't that centrally involved in, and you wonder, something must be happening here besides this. And certain people that were centrally involved may be completely shut off, and you think, well, what's happening there? And certain people that you don't see as being leaders sometimes really kind of step up and take leadership roles in those circumstances. So,
But it's interesting that you're going in that direction. Spent the last 6 months or so looking into how to help people that operate in high stress leadership roles deal with the stress of those roles. And I took a look at how folks are helping reduce post-traumatic stress disorders. And your process is intriguing because that's exactly what they're recommending now. So you have a high-performing team put in a difficult situation. You debrief with each other
yeah.
because it's only from your peers that people really resonate with the feedback. You know, an outsider trying to do that doesn't have the same impact as
Right.
you and I working shoulder to shoulder, and you're saying, Jerry, you really didn't make a mistake there.
Yeah.
That was the best we could do at that situation.
Right.
And that just lowers, it's fascinating. Yeah. very
In
intriguing.
our ER, we have several physicians that work together at the same time, and part of the group dynamics for our group is that we genuinely like each other.
Right.
We're ER people, we're similar, so we all like each other. So we get along, and I think that's sometimes informally what we do when we know somebody's had a bad case. Or if we know, a great example is we kind of pre-brief where we have, if I know a pediatric drowning is coming in, I'm going to go to the physician and say, this one's pretty close to the age of your kid.
Right.
Don't
Stay
let
away.
me go in there. You know, we try to protect each other from bad circumstances. So
Excellent. Well, we want to thank you, A, for coming in and being on camera with us, but second, just the great work that you do.
oh,
Thanks,
thank you
Pete.
very much, Derek.
All right.